Oh, my name is Buasisi Pandon. I work in here over 20 years already. We grow a lot. Before, when I got the job here, it's about not even 20 people. It's about very small over there at the Maynard Avenue over there. Then now it's over 200 people. Very big.
Actually, I started coming to the International District when I was still working at Providence Hospital. And I used to come to the International District after I finished working at the hospital. And then at the time they were starting the International Drop-In Center.
I wanted to participate some way, and so there was a group of young health professionals that wanted to start a free clinic, and I thought, well, that would be a good positive way to contribute to my community, and so I joined them, and we opened this clinic up there on Beacon Hill in Dr. Koh's office. We started out with 1 or twice a week, and we were looking at helping the Asian elderly in the hotels down in Chinatown area, and so we worked with those people, and eventually we were able to have a clinic down in the International District.
And I think I was sitting around with Bob at Four Seas, and the back of a napkin drew out the floor plan for a clinic, and he said, "I know just the place." Saying that initial facility, he brought me over and made arrangement with King Molinas. And Bob says, "Come on, I will show you this location." And we come over there, and King quietly walks up and opens the door, and we go in this very dark room with these blanket-covered, it looked like cable spools that were the actual tables in there. And I guess King wanted to give up his lease on that, so he said, "Well, take this." And so Bob and I said, "Sure." And little by little start putting the pieces together. And before it was even remodeled, I remember the Asian Community Health Clinic volunteers decided to hold some clinics down there. So we strung rope across the walls and hung blankets and brought some exam tables down and started opening up a clinic.
It was very small. It was across the Hing Park at that time. I think there was only 2 exam rooms. I mean, it was very, nothing was new about. I mean, it was an old place. I mean, it was fixed up. Probably not fixed up really well. It got renovated. I don't know how many years later, but the beginning was pretty bare minimal. But in the beginning, the patients would come in and get their blood pressure taken, or see the providers, and then they would stay and chat. I mean, they would come in and say hello every day. So, we got to know them, and plus the nurses went out. They went out to their hotels, and people that couldn't make it. So there was really a rapport that developed, a very personal thing in the beginning. So it was not just that we didn't know them. We all, in the beginning, all the nurses, the staff that were service staff, we all really knew these these people. We got to know them, and it wasn't. I can't say that it was like I mean, those are the, I joke about this, but those are the years that I learned how to drink wild turkey after work, I'd go up to the bar and then meet Bob up there and wild turkey straight up.
Well, yeah, I think, in fact, I hesitated to take the job because of the state of the clinic. You know, it was in a very, you know, storefront, you know, and everything was very crowded, and they were working, there were a lot of, you know, working off of old furniture, and, you know, it's not really the ideal condition for a medical clinic. And, but nonetheless, there was something about the mission of ICHS that drew me to take the job. And I remember one of the first things we did was to really upgrade the clinic, the clinic facility. The other thing I saw about that was important for the future of ICHS was that it needed to grow. You know, the model of service that we have, bilingual, bicultural staff, is not a cheap model, but it is an effective model for our community. So I knew that eventually for ICHS to get the resources it needs, attain economy at scale, so to speak, it needed to grow. When the Village Square proposal came up, it served two purposes. Number one, it allowed us to move us into a larger clinic. You know, at the same time, it allowed us to begin to partner with other API social service organizations to develop a comprehensive scope of services to our community.
Well, one of the unique things about ICHS is that embedded in its history is the way we provide service to our community. So we've always tried to provide the right mix of language and culture in our staff. We actually recruit heavily for people with those skills, you know, in addition to their medical, dental, or healthcare skills. And so we do that, but I can tell you it's an ongoing challenge to make sure that we have the right mix of Asian Pacific Islander languages for all the other groups, for the wide mix of groups that come in to see us. I fully believe that people need to understand how many shoulders they're standing on, the layers of people who have been here, have given a lot. And because our community has been changing and evolving too, it's a sense of place, you know, where we are as individuals in that continuum of International District community or Holly Park community, the Seattle community, the API community. And one of the things that happens with a lot of immigrants and refugees, and I know this because I am an immigrant, is that you come here, you're displaced from your country, your home, and you're lost. But in this community, they're not lost. And for our staff, for our patients, they need to know that this is a home to them. Yes, it's a medical home, it's a dental home, it's a healthcare home, but this is a place for them. And to be able to understand your place in it or their place in it, they need to know who else is there, who else has been there before them, so that they can be part of the future too, and they can be part of that continuum of people who are here, who are building this community and providing a very critical service to the community.
The passion that we have for this agency is just huge, and I would say that, and it's fun. You have a great group of people who are having fun every day.
To be able to see the clinic, it's like I just felt like it's a dream come true. This is kind of how I was hoping the healthcare will be here.
I mean, I sat back over the years and I've watched it grow, and it was just kind of like a proud parent. I mean, it was amazing. No, I didn't. I mean, I think like maybe the first 20 years were struggle and survival type of years, and you know, and then maybe the last are growth and the future. So I never envisioned. No, I didn't. Back then, when you're back in 1973, 75, no, I never realized that, or could think that this clinic could be, you know, the largest API agency in the state.
I think I see us growing. see us that we'll be able to expand our services potentially to northern King County, eastern King County, or southern King County, to be able to offer culturally competent services to our Asian community.
So it's just amazing to see, you know, how much has developed from days where we used to get copy machines by talking to salespeople and asking for a trial period. So we would get a copy machine for a couple, 3 months and free paper and didn't have to pay anything for it. So all we had to do was line up a variety of copy machines to try out so we could save money and keep the clinic going to what it is now.